So that was the system. Good afternoon to everyone here in the UK and everyone in Israel. As Ivana mentioned, my name is Ofer, and I'm the head of the Israeli Economic Mission to the UK. And indeed, it is a great pleasure for me to take part in this very important webinar. When it comes to UK dentistry, the US film industry has a habit of mocking UK dentistry with characters like Austin Powers and others who tend to have very bad teeth and dental habits. However, in practice, I can share that the UK dental industry is very advanced and many dental services are provided within the framework of the NHS, the Public Healthcare Service. The dental market, as you will probably see in the future slides, in the UK is expected to reach a size of over £6 billion in 2022 and employ below 50,000 practitioners around in the United Kingdom. Already, there is a chronic shortage in the UK of dentists, and with the expected growth of the market, together with the structural changes in the dental market, there is more openness to digital and innovative solutions. Having said that, one must understand that the market is generally conservative, so changes do take time to catch. I'm sure that the group of professional speakers today will be able to shed more light among Israeli dental companies on the challenges, changes, and opportunities in the UK dental market. And finally, going back to my opening line on the cinematography of the UK dentistry in American movies, they can mock the UK, but most Americans can only dream of public, high-level, and affordable dental healthcare as provided here in the UK. Thank you very much. Ivana, you're on mute again. Third time a charm.
Apologies. Thank you, Ofer. We organized this event in close cooperation with our partners at the Israeli Export and International Cooperation Institute, and so I am pleased to welcome Rafael Mog, the head of Oral and Dental Technologies at the Israeli Export Institute.
Hello, everybody. I'm very pleased to have this webinar. Thank you, Ofer and Ivana, for organizing it. I thank the esteemed guests for participating and sharing their knowledge. We will have as a number of participants that are joining us today are mostly in the sector of implants, which is not surprising because in Israel, this is the sector that is the biggest and most known, where Israel has already have some major exits. But Israel has also many other sectors around implants, like bone graft, where we have a lot of representative also today, but also in many other technologies, sometimes niche technologies, where there are many innovations, such as digital sector, which is also growing now in Israel. And sometimes technologies are not known because they are sold as OEM, but have a really high share in the market. So we're very interested to learn more about the UK market, and thank you very much, because I think there's a lot of potential for cooperation and looking forward. Thank you.
Thank you, Rafael. And now, without further ado, I'm excited to welcome and hand the word over to our guest speakers from the UK. So Edmund, please feel free to take lead on our virtual podium. The floor is yours.
Thank you, Ivana. Let's just see if we can share screen, and hopefully that will all work. And does that look okay for everybody?
We can't see it yet. Oh, now it works.
That's wonderful. That's wonderful. There we go. Right, welcome everybody, and thanks very much for this opportunity to speak to you all today. Quite a lot to run through from all of us, but I will try and get this into the 20-minute slot. So Ivana and Ofer have just asked me to kick off this session with a little look at a brief market overview in terms of the dental industry in the UK. So I will say we haven't got a huge split. We are at the moment in a little bit of a hiatus in terms of how we look at and develop a lot of information vis-a-vis specific market sectors. But what I can do is give you a feel for the market, how it's structured, overall cost, and information that I hope is beneficial to you all. I'm sure a number of you may be aware of some of this information already, and I do apologize if I'm going over ground you may perhaps be familiar with. So I think just to set the scene briefly, for those that don't know, Offer already talked about the NHS and how the Americans might view dentistry in the UK with a little bit of disdain. But when it comes to digging in their pockets and actually having a world-class oral health system available at point for the population, I think a lot of countries, we are the envy of a lot of nations around the world, although all is not quite as it seems, but we are proud of our NHS dental service, although it does face very significant challenges. So a little bit of background, basically in terms of public access dentistry, as part of its commissioning of services, NHS, in this example, NHS England commissions all these services. So that's primary dental care community, secondary care services, dental hospitals, and urgent care dental services, which were particularly relevant during the pandemic. So from an NHS, so high street dentistry, the primary care dentistry that we'll all be familiar with, is very vibrant in the UK. We have a mixture of NHS and private practices, and indeed the majority of dental practices are mixed, therefore they undertake NHS and private work. As a rule of thumb, we would say a practice is basically purely NHS if they undertake over 80% of NHS work, or a practice is purely private if it undertakes 80% of private work and a small percentage of NHS dentistry. So the bulk of practices on the high street, there is a growth in the purely private sector, and some of that has been exacerbated and developed on the back of the impact of the global COVID-19 pandemic. Then, of course, there's secondary care, of which colleagues will talk about a little further today, and Rupert will talk about. So that's the specialist dental services, which is not delivered in high street surgeries to an extent, but in secondary care settings, in acute hospitals, foundation trusts, district and general hospitals, and dental hospitals. And as I say, we'll hear a little bit more about that later. And again, another important factor, and especially for those of you looking to break in high tech products and equipment, there's a significant growth that you'll be aware of corporate dentistry in the UK. I think dating back, golly, about 2006, I think, I could be wrong, forgive me, but the dentistry in the UK was opened up to corporate bodies, allowing venture capitalists and groups to come into the marketplace. So we have sort of hundreds of providers within the sector, some maybe just local collaboratives or 2 or 3 practices, or the My Dentists or the Boopers of this world with 600 plus practices. So you can imagine the purchasing manager of one of these practices is a good person to know in terms of developing sales and opportunities. It must be said, I guess all of you are probably aware of implantology in the UK. It's a growth market. It always has been a growth market, and it continues to be a growth market. Compared to other global markets, I guess we are behind the curve, especially even if you just look at the rest of Europe. And that's partly as a result of, I think, of the structure and the fact that implantology is not regularly available under NHS dentistry and is more seen as an activity within the private sector. So a few little headline figures. The number of actual wet-fingered dentists is just under 29,500. Out of those NHS dentists, about 16.5% are actually, about 4,500 are actually owner providers. So they are dentists who own their own practice and are doing that work. And as Offer was saying, total spend on high street dentistry is about 8.6 billion currently. Number of high street dentists, physical practices, 8,732, and we've seen a growth in purely private practices. So those are those practices that concentrate 80% plus on private dentistry is a growth area. In terms of overall dental professionals, we've got around 72,000, and that includes obviously dentists, dental therapists, nurses, laboratory technicians, etc. And apologies for any of my clinical colleagues I've missed out on that list. And just a couple of other little headline figures there. We see that in terms of marketing and sales, and the impact of the pandemic, over half of dental professionals now enjoy or prefer remote meetings. And I'm sure you have all, with your global experiences, seen the move towards and the benefits, potential benefits of virtual meetings. But we're certainly in the UK, although we are seeing a significant rise in COVID levels, we've got one of our biggest dental shows just this week, which is run by our organization. So we do have, and we've got a lot of registrations, so hopefully it'll be good to see a lot of our clinical colleagues face to face again. And then to finish, the impact of the pandemic is really a mixture of data that's finished at certain timings through the year 2019, 2020, so 2021. So some will be massively impacted by COVID. Some might have been just about impacted if it was data ending 31st of March 20. So total adults or courses of treatment down 67%. Dentistry in the UK did shut down for about an 8-week period that you might be aware of. And then just another point from the tech side, that post-Brexit, there are a lot of regulatory changes, which I hope I can remove some of the concerns or fears about. But a lot of companies working in and around the UK and indeed across the world see compliance costs of one of the significant increasing business pressures or cost pressures going through 2021 and onwards. So as we've seen, 29,500 dentists actually practicing on the high street. Private dentists around 6,000, with a bit of a growth or significant growth over the last 12, 15 years. Dental student intake increased marginally, but 1,000 students a year. An important one, I guess not so important in some of the marketplaces our guests, our colleagues on this call today are looking at, because we have seen NHS funding is always a challenge, whether it's in secondary care hospitals, hospital trusts, or dentistry. And in terms of the income and the dental contracts that operate in the UK, we have seen a significant real-term or downturn in or real-term decrease in profit levels. It's becoming quite challenging out there. Gross spend on high street dentistry across the UK from an NHS perspective is 3.6 or 3.7 billion, and we see the gross spend on private is 4.9. Therefore, total spend, as we said, was 8.6 billion, but increasing slowly. A little bit of ideas about this is NHS data. About 8 million courses of adult treatment were undertaken. That, as we'll see later, is a 67.4, nearly 70% decrease on the previous year. So big decrease in treatment levels. And there were 11 million treatment items were provided to adults. A treatment item, as we see in the bullet point, is basically a restoration, an extraction, a radiograph, basically radiographs, and then some permanent fillings and sealant and scales and polishes. And during the pandemic, urgent dental treatment represented about 18% of activity in the period we're looking at. And then just to have a look, give it a couple of very modest insights into sort of the UK market. We do, as a dental industry association, survey our clinical colleagues every couple of years just to see what the sort of ideas are, how they interoperate with the industry and how they make their purchasing decisions. So we see that 74% of colleagues that we survey place most consumable and small equipment orders without involvement of a sales rep. So of course that's retro, 3/4 of consumables bought, very simple purchasing. Larger equipment, as you can imagine, and I guess that would include implantology, digital imaging, and some of the equipment that those of you on the call today are involved in. Basically, they still like to chat with sales reps, whether that's virtual, face-to-face at exhibitions, and there's a bit more information we'll see about that later. And then, as I said, about 54% of respondents are growing more fonder of remote meetings with reps, but still in large equipment and larger purchases, then decision makers are quite keen to see people. And there we go. 76% of respondents indicated they do undertake sort of detailed ROI analysis of purchases of equipment, of small equipment as well. So, load of graphs here. I hope they're interesting. I will go through them relatively quickly, and they do just indicate, sort of reflect what I've already outlined briefly. So there we can see high street dentist ending 2920, the 29,500, so gradual increases over the years. So that gives us the number of dentists working in the high street. And then we look at much lower numbers, dental hospitals. So we see down from just under 30,000, the number of hospital dentists around 3,600. But an increase, the 22% increase looks dramatic, but in fact, it's a small growth, and some colleagues in that sector may have more to say on that. But just to give you an example, between the 30,000 working in the high street and the 3,000 in the hospital sector, the secondary care sector. We can see a growth in registered dentists over the period, and so we now have 41,700, which has increased, but that of course doesn't reflect the fact that all of these registered dentists are actually in practice, and that so maybe a lot who are working part-time, semi-retired, or working in other capacities. So it's not a direct correlation to very significant of numbers actually sort of physically working on the high street or in hospitals, but just gives you a feel for where we are in terms of total numbers. Now, interestingly here, we're looking at the number of high street practices, so actual dental practices all over the UK as part of NHS. There are a total of 8,732, and you will see a decrease. So very difficult to tell on these graphs, but a decrease sort of leveled out a little. But again, in terms of practice and in numbers of actual practices, we look at different elements of treatment. We look at changing contracts. We look at different numbers of dentists and associate dentists, i.e. self-employed contracting dentists working in high street practices. So we can see, so that doesn't necessarily, we see a reduction in practices from 11,000 to 8,700, but that doesn't reflect necessarily a decrease in overall work undertaken. And just to note there that there are approximately 3,320 purely private high street dental practices. These numbers are estimated. It's difficult to get the exact figures. So 8,700 NHS dental practices, and of course a number of them, a majority of those will be mixed, and we'll be looking at potentially offering things like implantology and more high level, high-end treatment, again, which is potentially of interest to actually looking. We can see the number of dentists actually working in the high street. That works out at about 3.4 dentists per dental practice. And again, it doesn't necessarily mean there's sort of significant growth in what's going on. It reflects changing working habits, maybe part-time activities, etc. So again, it's difficult or not so simple just to correlate actual numbers against actual activities. But the figures show there, obviously, that we have the number of NHS dentists continued its upward trend. And let's say that is shown in the graph, particularly looking at obviously England, which is the biggest of the nations constituting Great Britain and Northern Ireland or the United Kingdom. So just having a look at a slide here, which is maybe a little bit of interest, which is expenses. So if we look towards the left-hand side of the graph, this is where it gets a little bit more interesting, I hope, to today's audience, where we see, I think that is probably fairly universal, and I expect a lot of you as manufacturers and sellers of product probably, I guess, feel sort of similar or recognize similar trends globally. If we look at the private sector, obviously where there's potential for higher investment outside of the constraints of the NHS system on materials and laboratory fees. But in fairness, the figures, I haven't actually got the graph to show today, but the laboratory fees are only about 2% higher, to about 12% share of overall expenses. The materials fees are about 2.5, not a significant change. Where we do see some changes, and perhaps not ultimately relevant, is in the third column, which is associates. Associate dentists are qualified dentists who are effectively self-employed, and a lot of NHS practices employ these associates. Less in private practice, where it's more likely to be owner-operators or dentists who are fully employed by the private practice. So I hope that just gives a little feel, and you can see over the 6-year period, not significant changes in that cost split or cost share breakdown for lab fees and dental materials. And here we're just having a look at the spend on materials, nominal and real. We can see a significant or a reasonable growth, as we see there, up to 612 million in nominal. But when we look at real term adjusted for inflation, we see that slightly different picture. So yeah, a market worth around over 600 million in terms of growth in purchasing in actual real terms. And then just looking at overall expenditure on the marketplace. So what we see here is effectively the real spend on NHS dentistry, where the NHS spends £3.6 billion a year. So that's basically they are spending on the provision of healthcare in the sector. But in real terms, although you see the expenditure increasing over the period, in real terms, it's actually really a decrease of about 6% of expenditure over the last 20 odd years, or 15 or 16 years. And of course, the NHS does actually charge. NHS dentistry is not free at point of service. Patients are charged or receive a patient charge, and the returns to NHS or the government in the UK, £85 million are raised in patient charges. However, that obviously fell significantly with the tens of millions of activities, dental unit activities that we didn't see as a result of the COVID impact, and also as the result of the constraints of the significant infection prevention and control strategies across UK dentistry, which I believe, including fallow time for aerosol generating procedures, were probably some of the strictest IPC requirement in dentistry across the world, and something we were very interested to monitor across the pandemic period. I'm just conscious of time. I'll just flick through. This graph shows nominal and real expenditure on private dentistry, and we see a figure of just under 5 billion. And I guess no significant, looking at the real down, but this doesn't reflect, I guess, an increase in growth in the private dental market as a result of the pandemic and in the post-pandemic era, when, because of constraints on NHS dentistry, there's a much greater growth and a migration from a number of customers who were able to afford it to move from NHS dentistry to private dentistry. So will be interesting to see this year's figures for us. So that effectively gives us a total spend on dentistry of 8.6 billion, as we looked at earlier. And I think in one of the graphs we did look at the profitability of NHS dental surgeries, and I do think, alarmingly, given the costs and price increases and lack of investment in dentistry, I think the actual profits for a high street NHS practice have dropped over the survey period. So although we've seen a growth in number of dentists and growth in activity, the profitability maintains or is currently still an issue going forward. And you hope there's wholesale review of dental contracts in the UK at the moment on the NHS side. And it'll be interesting to see. There's some very earnest discussions with government and the dental unions on seeing how that pans out. The current system, I think, needs significant reform, and there have been a lot of learnings from the pandemic. Just moving on to very briefly to some ideas about the marketplace. You can see, looking at these sectors, consumables, labs, small, larger equipment, the practice owner is the person to go after in terms of decision maker for purchasing, and particularly in those higher end areas that I think and higher tech and innovative areas that a lot of our audience today are involved in. It's getting to the person with the money, which is the practice owner, or indeed the purchasing directors of the corporate dentals, if they are significantly involved in an element of private dentistry. And of course, in a lot of the high-tech treatments, private dentistry can be used as a way of getting the equipment into surgeries, and then that can cascade down cost savings in terms of CAD/CAM, chairside milling, and that sort of thing, in terms of benefiting national health patients as well. Yeah, we've had a little look at some of the graphs there about working with consumable small equipment and large equipment, in terms of what people are looking at in terms of interaction with sales reps. And then again, we have more chance to look at this if the slides are circulated, but key decision factors are clinical need, what is learned in lectures and training courses, and peer recommendation. So although dentists are particularly keen on special offers, promotions, and ROI, certainly for, I guess, if you look at large equipment, or indeed including innovative and new equipment, clinical need and peer recommendations are very important. We can see very briefly here some costs, some of the impact of COVID, where treatment levels dropping from 27 million to 8 million. And again, for to be seen, having a look at the figures in due course. And really, offer has come on now, and I'm running a few minutes over. So don't be scared by what's happening with regulatory. Massive regulatory changes in the UK, post-Brexit, new medical device regs. Yeah, we would have heard of the UK CE mark and having responded very tight deadlines. But what I would say to this group is, if your product is CE marked, I think it will be available on the UK market for quite a while longer than the 23rd of July 2023 cutoff point, which is currently being sort of broadcast and people are aware of. We don't have the capacity in UK to get everything in line and the whole new regulatory process in by the 30th of June. And I think government are going to be saying a few things about that in the next week or two. So I won't go into detail given the time on the regulatory sector, but a lot is available on government websites. And I think your CE marking of products will allow you to access the UK and GB markets for significant time going forwards. Apologies if I've overrun slightly. I hope that was useful and interesting. So I'll stop sharing if I may, and just have a catch up on the chat. So I do hope that was helpful.
Thank you, Edmund, for the very comprehensive introduction to the UK dental sector and its stakeholders. And now it is my great pleasure to hand over to Dr. Rupert Austin, Senior Clinical Lecturer and Honorary Consultant at King's College London and Guy's Hospitals. Rupert.
Thank you very much, Ilana. I'm just sharing my screen.
Thank you.
My audio is coming through okay, but my video might not be because my camera's been disabled again. Apologies about that. But I think participants can see my screen, which is fine.
Yeah.
Much. And thank you, Edmund, for a very comprehensive overview of the UK dental market. My name is Rupert Austin. I work for one of the largest universities in the UK. We graduate 20% of the UK's dentists. And we also have the largest specialist training facility in the UK in terms of training future specialists who then go out there into the marketplace, and 90% of whom are practice owners. We have 9 faculties in King's College London, of which the Faculty of Dentistry is one of the largest. We are based in central London, and we have a mission, which is to improve products, policies, and practices to further the oral health of the UK and the world. So we're rated #1 for dentistry in the UK, 3rd in the world for oral and dental sciences. And one of the key benefits of working with us is that when we do publish research, it is cited extremely highly and impacts the marketplace. So we do have a lot of heritage in doing clinical trials with dental implant companies. For example, in 2007, 2008, we did the first clinical trials of the OsseoSpeed dental implant that at that time was owned by Astra, a very famous Swedish company, subsequently bought by Dents by Sirona. We have the largest postgraduate program in Europe, actually. And so we attract international students from all over the world, and they regularly consult with us on setting up hospitals internationally and launching products internationally as well. So our faculty is led by various deans, and very nice gender balanced photo here, I think, indeed. And we're very proud of our diversity and inclusion and working with people all around the world and being a very friendly place. So one of the things that we're most proud of in the last 2 years is installing a completely seamless virtual reality simulation suite from patient scans into haptically enabled trainers, simulators, like a flight simulator, then exporting those scans once a student places a dental implant or does a crown preparation or does some surgery in this haptic simulator, exporting those scans back into CAD/CAM software to then design and manufacture appliances based on the real patient data. And that trains our students to carry out surgery on real life patient scans before then doing it for real on patients. And this is unique in the world. It's the most integrated haptically enabled simulation suite that is currently in the world. For it, we collaborated with a Dutch company called SimToCare, who make these simulators, and a Finnish company, Planmeca, who make CAD/CAM devices. And working with them, we have got the world's most advanced simulation facilities. So we are trying to really give our students the cutting edge in terms of haptic and scanning technology in order to graduate them for the worldwide dental market. Because as Edmund said, there are significant cost returns and investments on direct chairside CAD/CAM restorations. And there's also massive benefits in terms of educationally being able to capitalize on those learning experience with augmented reality. And going forward, of course, then moving into the robotics in terms of simulating surgeries and then robotically remotely operating robotics, of course, is the next step in terms of the future market. And I know that many of Israeli companies are working on those sorts of robots at the moment to provide very sophisticated patient care. So we do collaborate extensively with industry. We have an embedded unit from Unilever, for example. We have 8 Unilever scientists who are embedded in-house in King's College London. They are working on oral care products, toothpaste, mouth rinses. They're working on microbiotics and various innovative technologies to bring to market. We also have very strong collaborations with various other industry, which I'll come on to a second. Industry like to work with us in terms of our craniofacial regenerative biologies. So I mentioned about clinical trial in terms of OsseoSpeed dental implants. We also did a lot of the regenerative implant clinical trials in terms of BioGuide, using membranes and using osteoinductive, osteoconductive techniques in terms of bone biology. We have specialist bone biologists who are looking to eventually, hopefully, regrow an entire dental tooth, so that in the future, perhaps, who knows, dental implants will be phased out and we'll be able to regrow patients' own teeth with human enamel and dentine. And then the implant market will be superseded by regeneration of individual teeth. Obviously, that's an aspiration at the moment, rather than an actual physical product yet, but that's what we're working towards. In terms of host microbiome interactions, we're extremely knowledgeable on the host and microbial response in terms of peri-implantitis, in terms of interfaces such as rough titanium surfaces and regenerative interactions between the host and also looking at oral flora in terms of companies that look to drive the oral flora, such as toothpaste, mouth rinses, and so on and so forth. And then in terms of clinical and oral translational research, we have an extensive biomaterials facility for testing implant components. We can test implant components up to millions and millions of cycles to see how they function biomechanically prior to putting them in somebody's mouth. We do run extensive clinical trials, and we have very strong collaborations with some market leaders in this role. I'm currently doing a clinical trial with Colgate, a PhD student sponsored by GSK. But we also have much more bespoke collaborations with smaller industry partners in terms of providing consultancy for new biomaterials, new components, and so on and so forth. And we do welcome contact from your industrial colleagues in terms of thinking about research. So that's really my presentation. I'm going to end there because I am aware of time. Thank you very much for listening, and we hope to see you in London soon.
Thank you, Rupert, for giving us the in-depth overview of King's College London and the possibility to host clinical trials in the UK. And now I'm pleased to hand the word over to David Ezra, the CEO at Vantagehealth.
Thank you. I'm just going to share my screen. Second, share screen.
Oh, Rupert, I think you need to close first your screen. Yeah.
It's fine. Can you see my screen?
Yes, it works great.
Okay. Super. Thank you for having me, and I'll be as brief as possible, and hopefully it'll be informative. So I'm David Ezra from Vantage, founder of the company. Been running for about 15 years until recently acquired by the Japanese company NEC. We provide a AI-powered referral management platform called Rego. and we're very fortunate to have been quite successful in implementing our solutions across the NHS to support all healthcare specialties. But we cut our teeth, pardon the pun, in dental, with dental referral management. And we currently have in excess of 40,000 clinical users, so covering about half the country with referrals coming from primary care, so NHS dentists and independent sector dentists to hospitals to ensure their patients are seen at the right place at the right time. I'm going to whiz through some of these slides, but I think they are quite important. So as a company, when we first started out, we had a very, very clear vision, and that was to optimize patient flow through innovation, using our technology to truly transform healthcare services. A core set of values, essentially to learn as much as we can, do as much research, collaborate with people already in the industry, and then where we saw opportunities, just act in a very Israeli style. When we see something, just go and do it. Key features of our platform, just by background, there's a lot of AI involved in that, not machine learning, but more augmented intelligence. Essentially, what it does is that at point of referral, so when a patient is with a dentist, they use the system to assess how complex a procedure could be, and whether if they can't manage it, to be able to see, well, it could go to King's College, or could go to a local provider in the community to have that patient managed effectively. And a couple of tools to also expedite treatment, including some very nifty image sharing technology to be able to support that. The key benefits of the solution, essentially to reduce the demand on services, so avoid inappropriate referrals, improve patient outcomes, that is at the heart of it, to make sure patients are seen at the right place at the right time, to optimize the use of clinician time, and to provide the NHS with two obviously very important things. One, to have full visibility over the activity they have. So prior to our solution, everything was very paper-based, and lots of manual interventions, but now they can see everything with a click of a button: how many patients are being referred to hospital, how many patients are being retained in primary care. And what that has then is delivered millions or tens of millions of pounds of savings to the NHS. I'm not going to go touch on this slide, it's very busy, but essentially it shows Rego, our essential platform, with lots of nice integrations with existing systems within the NHS, which allows our services to work very nicely. If anyone has any questions about this afterwards, I'm happy to take it, but I'm just looking at the clock right now and think about 15 minutes left, so I'm gonna whiz through this. As a case study, one of our earliest implementations was across the southeast of England, which involved just under 1,500 dental practices, the majority of which are NHS practices, but we did have a number of a couple of hundred independent sector, completely private practices as well. It involved over 21 hospitals and 150 community providers. So orthodontic providers, what the NHS calls intermediate minor oral surgery practices, where they do extractions, which are more complex than the regular dentist would do. The key challenge was that lots of referrals are being sent everywhere without any real filter. And although there's lots of referral criteria and guidelines, dentists didn't really know what to do. And so the implementation of our system managed to reduce the burden on hospital services by 30%, and that's estimated, and perhaps more. We, through the system, managed to close referral management centers, which were essentially teams of people looking through paper-based referrals, and eliminating all that the need for the necessity for referral management centres saved over £4.5 million over 6 years alone. Going to flick through this. What I really wanted to focus on, if I could have your attention just for a few minutes, was the key lessons that we learned as a company, which I think would be really important for any entrance into the market. Firstly, is to understand the pain points. By that, I mean, essentially, what is causing the biggest problem to the client, so to the NHS or to independent sector. Where does it really hurt them? Three things to look out for is time, money, and emotion, standard sales stuff. So where we can improve efficiency and optimize their time, where you can save them money, and is it nice to use? Is it easy to use? Very quickly develop a return on investment case, if you can, when you're approaching people, to show how that would actually return money into their pockets. Identify the commissioning structures, like who's the actual buyer, of this solution. It might not be so clear to start off with, and you have to go through the process and speak to as many key stakeholders as possible. What is obvious might not actually be right, so really focus on who's actually going to be paying for your services and your solutions. Integrate where possible. So if you're an IT-based solution, make sure that you understand what existing technologies are out there, what dentists use day to day to try and make it seamless in their workflow. I know people develop really nice standalone solutions, but particularly when you come to the UK, people like to see things how they work together. Very, very important one. The NHS and dental in general, very, very hot on clinical information governance. So really take that seriously. Really understand how you can make your system safe and appear very safe. So there's lots of clinical governance to be aware of. Design your solutions around what is needed locally and understand their requirements. So one size generally doesn't fit all. It's important to make sure that you understand how things work locally. Really, one thing that worked for us was investing in user engagement. I've got a spelling error here, and support for change management. So if you bring some innovation into the industry, it still needs to be treated with kid gloves, and to make sure people understand why you're doing what you're doing. Always provide them with the support they need, and that's going to be essential in evaluating the outcomes, which is the last bits, to make sure that you can really evidence what you've done, so you can package up what you have and then sell it elsewhere. So I think that's what works for us. I've tried to do this as quickly as possible. I hope it's helpful, and I'll return back to colleagues.
Thank you, David, for sharing your journey and the very useful advice on how to work in the UK. And now we have about 5 minutes for Q&A, and hence I would like to open the session to questions from the audience. So please feel free, everyone, to write your questions in the chat. I have here already a few questions that came through. So the first one is, how common is it for dentists to purchase directly from manufacturers? I think it is addressed to you, Edmund. If you can expand.
Yes, thanks. I think I've just put something in the chat, but generally the UK market is driven by dental profession working with wholesalers and distributors. So it does depend on some of the product sectors, but I would guess the majority of product is purchased through a dental wholesaler or a distributor. So the likes of Henry Schein, or the big other suppliers in the UK, company called Dental Directory and Wright's Health Group, plus many, many others. But there could be some sectors where you might approach directly, but generally it's still a system where dealers and distributors play a very important part, working with the manufacturers to service the marketplace, if that helps.
Perfect. Thank you very much. The next question is, would the FDA allow also to access the UK market?
Sorry, yeah. Sorry, Yvonne, I was just reading a bit of chat then. I do apologize.
No, I think the second question is, would the FDA also allow also to access the UK market?
Yeah, I think there's a couple of bits and pieces, I think, coming up on the chat regarding CE marking at the moment and accessing the market. Yeah, it's all changed at the moment. New regulations are due the end of this year, early next year. The process is very slow. From a larger, longer term perspective, I know that our regulator, the MHRA, is working very closely, or wants to work even more closely with IMDRF to look at global recognition of things like FDA, MedSap, and various other conformity assessment programs. The likelihood is that it will not necessarily directly accept those, but it would be a very simple process to convert FDA or MedSap into a sort of UKCA type acceptance. Again, there's still labeling issues there. And just in terms of CE marking, yes, as it currently stands, all CE marked product can be sold in Great Britain up until the 31st of June 2023, which isn't very long away. But I think the government is waking up and smelling the coffee and realise that there just isn't the resource to actually implement a transition period that short. And there is a hope that there will be, we're hoping for 3 or 4 years extension, but so I'm hopeful that CE mark will be a route to market. It seems ridiculous that a globally recognized, one of the highest global standards for medical devices, wouldn't be recognized in getting product into UK and could lead to product shortages and difficulties. So for those wanting to break into the market, there's a realization that there may be additional, as for any exporter, there may be additional regulatory requirements, but the hope is that the pain can be delayed for as long as possible.
Perfect, thank you very much. So the next question is, as a UK qualified dentist at Bart's hospitals in London, how much has the industry changed in the past 25 years? So I think it can be a question to you, Dr. Rupert.
Yes, thank you for the question, Moshe. So you graduated in 1997 by my calculations. So since 1997, Edmund, I think the key thing, 2006, a new dental contract came in about primary dental care, which drove a much more minimally invasive philosophy. And therefore, we don't do so many amalgam restorations anymore. We still do them. In the primary care sector, it's much more about getting the foundations correct. One thing that Edmund said in the very beginning is that we still have the lowest penetration of dental implants of any market in Europe, possibly even worldwide. We have some of the lowest penetration. And that's because the NHS acts as a barrier to entry for dental implants, provision of dental implants. Me in the hospital, I do an enormous amount of dental implants, but those are cases who have been deemed due to hypodontia, all sorts of specialist cases. But actually, that presents a massive opportunity for implant manufacturers, but it also prevents a barrier to market. I think those barrier to markets are still there that were there in 1998. Edmund, I don't know if you want to say anything more about that.
Rupert, no, I think that was absolutely spot on. I mean, gosh, a lot has changed, hasn't it? But yeah, I think those are very, very pertinent. So yeah, thanks for that.
Okay, thank you very much. So the next question is about clinical trials. So what are the options for clinical trials for dental implants, new products? And what is the process needed to collaborate with the King's College London on clinical trials?
Yeah, that's great. So our clinical trials unit is delighted to set up clinical trials. We do, for example, a 5-year prospective follow-up of new dental implants. We can install them in participants. We can recruit particular candidates according to your criteria. And our email address, I did, Ivana, pop it into the chat, but I'm wondering whether, Ivana, you could re-pop it in again.
Definitely, or I can basically write it as a follow-up after this.
Thank you. So we'd be delighted to do clinical trials for new implant products within the hospital in a very controlled setting with specialists.
Yes, another question. How many CBCT cone beam CT scanners are installed in the UK, and what percentage of those are used for dental implants?
A growing number. Edmund's waving his hand.
Yeah, no, Rupert, I haven't got precise figures for that.
Yeah. I mean, we personally have 7 cone beam CT scanners in our hospital. I've got one in the private practice I work in. I don't have figures. I tell you what hasn't been very well penetrated is guided implant surgery with CBCT imaging. We still do 99% of implants without guided imaging, which again is an opportunity, but potentially a barrier. The barriers that I spoke of are related to what we call NHS funding for dental implants. In the United States, other markets, most implants will be placed by insurance-based providers. Yeah, the UK doesn't massively major in insurance-based providers placing dental implants. So therefore, you've got either self-funded implants, pay as you go, or NHS funded within a hospital setting, of which the criteria are quite strict. So those are the barriers that we spoke of. And the amount of dental implantations is probably about, percentage-wise, Edmund, compared to other markets, what would you say our percentage in the UK in terms of uptake of implants is?
I would be very loath to put an actual figure out just because of unfortunately, the lack of collated data. But I mean, I would say very significant, Rupert. You know, 30–40%, maybe more, because it's just, as you said, it's just not happening. If you look at if you look at France, Germany, the European member states, in the way as you said, the NHS system just, you know, unless it's in secondary care where it's for.
Yeah. So in terms of secondary care, the way that we do that is we have a tender every 5 years, and we go through a procurement process. We open advertisements to all implant companies. Currently, we are the largest provider of dental implants in the UK. We have an 80% contract with Dentsply Sirona, 20% with Straumann, and every 5 years we re-advertise that. It is based upon the idea of placing implants in a way that the hospital is going to be able to retrieve components, you know, in 20 years' time. We want to be able to deliver implants today that we can then service for that patient's lifetime. It's also dependent on the training and education of our specialists. So part of our contract, we build in a certain amount of days training, education, and then we like to do research with those companies as well. In terms of barriers for private practices, as Edmund said, it's really at the discretion of the practice owner as to, you know, what they've been trained in using, what companies they're working with. So hopefully that answers about barriers for implants and numbers of implants.
Okay, so we have 2 more questions, new ones. So what is the amount of no, we already covered that. And are King's College engaged only in clinical trials or animal and in vitro trials?
Animals and in vitro. Yeah, so we have an animal license. We have all of the regulatory stuff to be able to use rabbits and other animals, mice, fly, all sorts of animals. And then in terms of in vitro trials, we've got extensive in vitro biomechanical testing devices, particularly an electroforce 33,000 TA instruments, which has been used by Nobel whenever they brought out their angle abutments. We tested those up to millions of cycles, installing them. Navigation surgery, again, a tiny percentage of the market. I mean, the UK, in terms of uptake of robotics and navigation and guided surgical, it's really poor compared to the rest of the world. You know, we have not adopted it. As Edmund said, it's quite a conservative market, I would say, the UK. And navigation surgery is done at Barts in the London. I know that they use, I forgot the name of the surgical navigation suite that they use. We don't use it here. I'm sorry to say that we haven't done yet. But conversely, we have an amazing robotic sector for prostate surgery, for example. But for dentistry, it's still not that adventurous. Dental technology is currently most sought after. I would say CAD/CAM scanners, having scanners that are able to do full mouth rehabilitation on dental implants to an accuracy of 100 microns, 200 microns. And also scanners that can be used for diagnostics in terms of measuring enamel erosion, changes in the mouth, as well as manufacturing restorations that are precise and accurate and well-fitting and integrate in an open architecture with other software. The reason that we majored here on Planmeca chairside CAD/CAM software is because of the open software architecture in the hospital. Sirona tend to be a bit more closed in their architecture, so we're looking for technologies that are open, that have open architecture in terms of their interfaces.
Okay, perfect. So I don't see any more questions in the chat box. So I would like to thank you all. And I'm afraid that our time is running out and we will need to conclude our today's session. So again, I would like to thank our guest speakers for sharing their insights and take this opportunity to thank you all for your time and dialing in today. We hope that you enjoyed the webinar, found the session interesting and useful, and we look forward to seeing you at our future events. So thanks again and have a great day.
Thank you.
Bye.